In this video, we will explore how to train your staff to be HIPAA compliant so you can put your private practice on autopilot. Hi, my name is Liz. Don't forget to hit the like button and subscribe to my channel so that you don't miss any future content. This video will cover the essential points of effective HIPAA training to ensure compliance and protect your patient's privacy. Hi, everyone. Welcome back to my channel. Today, we're talking about something critical for healthcare organizations, that HIPAA word again. So HIPAA training specifically for your staff. A strong understanding of HIPAA isn't just a requirement. It is essential for protecting your patient's privacy and avoiding costly violations. So let's go over a few ways to train your team and ensure everyone is up to speed on HIPAA compliance. First, let's talk about why HIPAA training is so important. HIPAA, or the Health Insurance Portability and Accountability Act, is all about protecting sensitive patient information. Training your staff ensures that they understand their roles and responsibilities when it comes to handling patient data, reducing the risk of breaches, and protecting patients' trust. Regular training isn't just a good idea, it is a legal requirement. And I know I've said this before, but I'm going to cover it again. They say that you should train someone in HIPAA each time you hire them and at least annually. So every year you need to retrain on any of the updates that there may be to HIPAA and go over the basics with them. When developing a training program, it is key to cover certain fundamental topics. Here's what every HIPAA training should include. 1, understanding PHI or protected health information. Teach your staff what constitutes PHI and why it's sensitive. This includes patient names, social security numbers, medical records, and even spoken information. In other words, if you're in the hall talking loudly enough for patients to hear you, you need to move to a different area of the hospital or clinic so that patients don't hear you. The HIPAA security and privacy rules. Explain these two essential rules. The privacy rules limits who can access and disclose PHI, while the security rule focuses on safeguarding electronic PHI. Number 3, common HIPAA violations and how to avoid them. Go over examples of common violations like unauthorized access to proper data, disposal, and explain how to prevent these mistakes. Number 4, data safeguards. Teach staff about physical, technical, and administrative safeguards. This includes everything from locking doors and securing devices to password protection and access controls. One of my favorite little tips for HIPAA is if you do happen to have a clipboard with any kind of information on it that is patient specific, I always took a thick blank piece of paper and put it on the top of the clipboard so that obviously patients or other healthcare professionals, if they walked by, could not see the protected information underneath of that piece of paper. By covering these basics, you're equipping your team with the knowledge to keep patient data safe. To make sure the information sticks, try to make training as engaging as possible. Here's a few ideas. Use real-life scenarios. Present scenarios your staff might face in their roles, like a colleague asking for unauthorized access to records, and ask how they would handle it. Real-life examples make the material relatable and practical. I had a director of nursing that when she was trying to train us, would like it says to do, she would make it as engaging as possible. She used to dress up as an old lady and do different things. One of the things that actually sticks the most in the back of my mind, because at that point I was a nurse's aide, she put crunchy peanut butter on a tissue and then she made us set our elbows in it. And during the entire training, she made us do that. And then she equated that to not taking care of your patient's toileting needs. So it was something that was obviously really visual and really a 5-sense experience for us. And obviously it stuck because it's probably been 15 years ago, but it really stuck for me. So things like that are really going to stick in the memory of your employees are vital when you're doing any kind of training. And now group discussions and role playing is another great way. So allow team members to discuss cases and even role play situations to reinforce learning. Role playing can really bring these situations to life and make training interactive. And we also did a lot of that in our different training sessions. Quizzes and knowledge checks. And I would recommend doing these throughout the year, do spot checks. Include quizzes at the end of each module to ensure that everyone has grasped the material. These can be simple questions, but they're a great way to reinforce important points. HIPAA training shouldn't be a one-time event. Regular training and updates are necessary to keep everyone informed, especially as HIPAA guidelines can evolve, and so can technology risks. Annual refresher courses and updates when regulations change will help your team stay compliant and avoid common pitfalls. Finally, document everything. It is essential to keep records of all training sessions, including dates, topics covered, and attendance. This documentation shows regulators that you take HIPAA compliance seriously and have done your part to educate your team. Also, make sure to monitor compliance by conducting regular audits. Check whether staff are following data handling and secure procedures in their daily work. Catching small issues early helps to prevent major violations later on. HIPAA compliance is everyone's responsibility, and a well-trained staff is the best defense against data breaches and penalties. I hope these tips help you create a strong, effective HIPAA training program for your team. Thanks for watching. Don't forget, at Curate Systems, we help you document it, delegate it, and get it done so you can minimize risk and maximize productivity.